Good morning, and welcome to this, the first of 3 Caring for Creation forums on this and the next 2 Sundays. We're delighted that you're here. In a moment, Scott Williams, one of our Caring for Creation members, will introduce our distinguished guest speaker. But I want to not only make you feel welcome, but ask you to please sign the sheet that asks for your name so we know that you're here. And if you provide us your email address, if you haven't done that before, we'll make sure that you're on our email list for future announcements of our events. And we also encourage you on the way out, if you haven't already done so, take a copy of our flyer and the updated brochure for our plastics recycling program. So, with that, I'm going to turn it over to Scott Williams to introduce our speaker.
Did you want to say a little bit more about the next 2 speakers, just to give a little...
Yeah, sure, I'd be happy to. Next week we have a little change from our typical forum presentation format, such as we're following today. Nancy Vetter-Schultz, who is a leader in the Madison group Faiths Connect for Climate Action, will be conducting a mini workshop, Finding Your Climate Story. The thought is that we communicate best with stories and communicate best with those that we know telling them our stories. So this is a way to help us become comfortable with our climate story. The following week, the 19th, is Dr. Peter Levi, who is the Conservation Science Director for the Wisconsin chapter of the Nature Conservancy, and he'll be talking about land, water, and wildlife conservation. So please keep those forums in mind in your planning.
Thanks, Todd. Hi, everyone. As Todd mentioned, I'm Scott Williams. I'm a member here at Bethel and a member of the Caring for Creation group. I also work at the Wisconsin Energy Institute at UW-Madison. And so I also help produce a lot of public education around energy and climate change. And through my work is how I got connected with our speaker here, Jonathan Patz. Jonathan is the John Holton Endowed Chair of Health and the Environment at UW-Madison with appointments in Population Health Sciences and the Nelson Institute for Environmental Studies. If you were to search, leading experts on the connections between climate change and health, he'd probably be at the top or very near the top of the list of that. He's been working close to years around the connections between how climate change affects public health, and then also on the flip side, actions that we can take that benefit the climate can also benefit our health. So he's got a background in medicine with an MD and an MPH. And he's dedicated his career to investigating these connections between climate change, human health, and ecosystem health. And through this dedication, he was elected as a member of the National Academy of Medicine, as well as shared the 2007 Nobel Peace Prize as an author for the Intergovernmental Panel on Climate Change. And from 2011 to 2022, he served as the inaugural director of UW-Madison's Global Health Institute, and has a new NIH-funded climate, I guess we can't, climate is not in the name anymore, but Center for Health, Energy, and the Environment Research. And he's a member of the Energy Analysis and Policy Graduate Committee, which I'm the coordinator for, so it's great to have you and share your knowledge with us today.
Great. Well, Scott, thank you. Thank you for that great introduction, and I'm honored to be the first speaker of a series of speakers on care and creation. I'm going to be talking about climate change as a health issue. I've worked on this for 30 years, literally, and I'm going to tell you about the issue, but then I'm going to tell you about why the solution and climate action could be an enormous health opportunity. So let's just start off. What is, the most dominant greenhouse gas is CO2 in the atmosphere. Unfortunately, this continues to rise. We're at 423 parts per million. And as all of this crowd knows very well, of course, I remember the late, great John Kutzbach, who invited me for my last lecture here. This is heating up the planet. And we're seeing news like this, that Phoenix, 100 straight days of 100 degrees. And this is from the World Meteorological Organization, showing that that it really it was the hottest year on record last year. So when you think about climate change, the physical attributes of climate change, it's rising in temperature, sea level rise from thermal expansion of salt water, but also land-based glaciers sliding into the ocean, but mostly thermal expansion of salt water. And then extremes of the water cycle, more droughts, floods, and fires. And that has implications when you think about pathways through which climate change affects our health. And there are so many of them. From the heat waves and the urban heat island effect, air quality, infectious diseases, food supply, forced environmental refugees, and mental health issues. I'll touch on a few of these, but you can see this is an old slide. I did this a long time ago, and it's why I dedicated my career in public health to climate change, because there's so many ways that it affects our health. So obviously when temperatures rise, that's a problem. How many of you remember the heat dome from the Northwest in 2021? That was an unprecedented event. Just temperatures going through the roof. Speaking of roofs, there was vinyl siding was melting off of houses. It was so hot. A town in British Columbia, Linton, BC, got up to 121 degrees Fahrenheit, and then just caught on fire. The town just went up in smoke. Well, weather is changing a lot, right? And we see these extreme events. But how likely was that event to have happened, to be that hot over that long a period of time? Well, there's new advancement in weather attribution science, to be able to say this storm or this heat wave or this drought, how likely was it to occur with or without climate change? So according to the latest from the World Weather Attribution Initiative, it's some of the best climate centers in the world, that heat dome of 2021 was made 150 times more likely to have happened because of climate change, because of the warming, 1 degree centigrade average warming around the world made that extreme event likely. In other words, 150 times more likely. It wouldn't have happened. It would be virtually impossible for something that extreme to have happened without the background of human-caused climate change. And with that heat dome, of course, not only did you have heat, but you had drought, and we had these wildfires that affect the entire country. I'll talk a little bit later about wildfire smoke. But just to touch on right now, for children, I know we have a family practitioner in our midst. Any other clinicians here? Okay, at least so. You probably are well aware of this study out of pediatrics that shows that wildfire smoke is especially dangerous for children. This study found that it's 10 times more hazardous for children under the age of 5. And so it's bad news for kids. And you were saying, tell me your first name again. Barbara was saying you're seeing more asthma patients.
Yes.
So this is something that's...
escalate their treatment.
Okay, see more treatment. So asthma exacerbation. And this is a study that Wisconsin was part of, this national study looking at ragweed pollen season. And especially in the northern regions, we're seeing 2 weeks longer ragweed pollen season because it is warmer. Wisconsin is 1 degree Fahrenheit warmer than the 1950s, and there's more CO2 in the environment. So some plants really do really well. So ragweed, poison ivy, these are plants that they like CO2. I'm not going to go into the malnutrition side. In fact, I have a whole group that I'm not going to show on food systems. But most food systems will be threatened from climate change. But if you're a weed like ragweed or poison ivy, you will do just fine. This ad came out from an NGO a few years ago. Global warming's greatest threat may also be the smallest. Why? Why would that be, you know? What's the difference between us sitting in the room and that mosquito? Besides the fact that we don't fly, and Scott, you promised me that at least 90% of these folks don't suck blood. What's a big difference between us mammals and that insect?
We're warm-blooded.
Yes, exactly. Bingo. We're warm-blooded. Our body temperature is, give or take a fever, it's always the same. This mosquito is cold-blooded. Whatever the air temperature is, that's her body temperature. And if she is carrying dangerous parasites, well, in this case, viruses, this is Aedes aegypti that carries yellow fever, dengue fever, and Zika virus. Whatever the air temperature is, that's her body temperature. And that completely dictates how fast the viruses develop. In the case of a different mosquito, malaria mosquito, it dictates how fast the parasites get into the salivary glands. And so temperature has a lot to do with infectious diseases carried by vectors like ticks and mosquitoes. So when someone says to you, you live in Wisconsin, yesterday and today are record-breaking heat days, by the way. Yesterday is record-breaking. I think today will be record-breaking. But of course, you know it's going to be below zero later, right? That huge extreme shift. So people will say, well, who cares about 1 or 2 degrees temperature? Biological systems. You know, 1 degree means everything about whether or not transmission will occur. Let me give you an example. When Zika virus erupted a few years ago, during that winter of 2015 into 2016, there was a very strong El Nino event. And in the region that saw dengue and Zika virus, especially in Brazil, Colombia, throughout Latin America, the temperatures, according to Dan Weimont at the our climatic research center at Nelson Institute, Dan Weimont calculated that the temperatures were 2 standard deviations above a 60-year average. So it was really hot. And not surprisingly, we saw during that winter the highest ability for that mosquito to transmit disease. It's called vectorial capacity. How are the environmental conditions such that one case of disease will lead to more cases? Well, it was the highest level. And so when you think about subtle changes in temperature, think about these vector-borne diseases. And it turns out that Zika virus is actually more sensitive to temperature than dengue fever. Anyway, these diseases that involve biological agents, especially the vector-borne diseases, are very sensitive. I was part of a systematic review that asked the question, how many human pathogens, many infectious diseases, but not all, some allergens, poison ivy, foodborne diseases, so how many are linked to either warming, heavy rainfall, flooding, droughts, these climate extremes? So I mentioned the vector-borne diseases, but then these other ones. We found over 1,000 pathways through which climate extremes affect our health. So really important to know that climate effects on health are way more than just heat waves. And there's a lot of attention on heat waves and deaths in heat waves, but it's enormous how many ways climate change can affect our health. And remember, it's not just temperature, it's about extremes of the water cycle. So from the extreme drought, let's just talk about, go back to wildfires. This is from the Proceedings of the National Academy of Sciences, showing that modeled increases in temperature and vapor pressure make climate change responsible for over half of the observed forest fire aridity that feeds the fuels and doubles the amount of land area. So, it's complicated about wildfires and there's land management, but when people say it's all land management, they ignore the science, and this is out of the Proceedings of the National Academy saying climate change absolutely is affecting fuel aridity and has led to a doubling in the amount of wildfires. Without climate change, maybe we'd see an increase in wildfires, but we're now seeing it twice as much. So we use this evidence. We've been pushing back. The Environmental Protection Agency wants to reconsider something called the endangerment finding, which is a finding the Supreme Court ruled in 2007 that climate change endangers human health. And then EPA was forced to do an assessment, and that verified it. And so in 2009, the endangerment finding was enacted that requires EPA to regulate greenhouse gas emissions. Well, this current administration, they want to say, no, we don't want to do that. So we, scientists have been gathering, pushing back, and we presented, this is part of our 50 pages of scientific evidence to say there's more certainty that climate change endangers health, not less certainty. So from those fires, you can see increases in smoke exposure. 2023 was really bad, so you can see that year. This year was pretty bad. This is from Steve Vavris, Wisconsin Initiative on Climate Change Impacts, the Wiki initiative with Nelson Institute and the DNR and DHS and other governmental agencies in Wisconsin. But this is the drought from this past summer. And, wildfire smoke can get really heavy. You can get into these very unhealthy air pollution levels. And this is just showing Wisconsin. This is from the Wiki Wisconsin Initiative on Climate Change Impacts. Actually, this is out of the State Climatology Lab, showing that 2003, Madison and Milwaukee got up into the purple, this very unhealthy range, 200 to 300 parts per million of smoke. And this is this past year in the red, pretty unhealthy, in the red zone there, unhealthy. So these wildfires, they're definitely affecting the health in Wisconsin. One other thing regarding droughts, this is not Wisconsin, this is in the Southwest. Coccidiomycosis, it's called valley fever. It's a fungal pneumonia that's been increasing with drought conditions in the Southwest. Okay, shifting gears. What about the other extreme? Warmer air holds more water, okay? So when it rains, it can pour because warm air holds more water. And you can see that Wisconsin is in this double hashed line, which means statistically significant heavier rainfall events. We are seeing heavier rainfall events, 7 inches more than it did 50 years ago. So extreme rainfall. What does that mean? Well, it means a lot of things. There are all sorts of health effects from flooding. You can read them down here. We've studied what the effect of heavy rain and runoff means when sewage systems can't handle all the stormwater runoff. There are many communities throughout the Midwest that combine sewage and stormwater runoff simply because it's super expensive to separate sewage and stormwater. So many places have not done that yet. Well, we looked at the Chicago water treatment and found that based on forecasted extreme rainfall events, that we'll see a doubling in the amount of these combined sewage overflow events when it rains so hard that sewage contaminated water overflows into lakes and streams. It happens every year, and it's getting worse, and it's going to get worse with extremes from climate change. One other thing that flood risk pose that people weren't anticipating, thinking about water contamination, that wasn't the issue coming into the emergency rooms. It was asthma. And as people would after a flood, you'd have a basement situation like this coming into the emergency room. And this is something that is really terrible, especially thinking about poor housing. And no surprise, a racist past, a flooded future. These situations, they're formerly red-lined areas where if you were black in America, you weren't allowed to buy a house somewhere in these low-demand, less favorable areas, maybe in a floodplain or something. So this is also an equity story. It's the same with urban heat islands. I didn't show the graph, but same thing. Formerly red-lined areas that have less investment, less parks, less tree cover, they are hotter during an urban heat wave. So there's an equity story with heat waves as well as with flooding. So I'm in Bethel Lutheran Church, so I want to talk for a moment about the ethical crisis, the ethics of climate change and health. This is a map that I did with Holly Gibbs when she was a student of John Foley's, and John Foley was a student of John Kutzbach. Holly Gibbs and I, we looked at the amount of CO2 that countries have given off. That's the top here. Who's the most responsible for, the greenhouse gases that are heating up the planet over a 50-year period? So the United States, we are the #1 most responsible. Africa, not at all. Germany, a little bit of China, but we're the worst as far as historically causing this problem today. But think about climate-sensitive diseases, malnutrition, malaria, diarrheal disease. Where do we see those climate-sensitive diseases? Sub-Saharan Africa. So really, those places most immediately vulnerable to climate change are the least responsible for the problem. Per person, Americans emit 6 times more CO2 than the average global citizen, or 30 or 40 times more than someone in a developing country from our energy habits. And again, this is just showing historically the United States is the #1 most responsible country. Now, China today, China is putting out more greenhouse gases, and they will catch up and become -- soon. Although China is also #1 in renewable energy. So China is really a mixture here. And as the U.S. is retreating from the global stage, China is stepping forward, making commitments to reduce greenhouse gas emissions. And electric cars, solar energy, they are just going gangbusters, although they're so big and they're still burning coal. But historically, the U.S. is the #1 most responsible country for the problem today. And our transportation sector by itself emits more greenhouse heating gases than all countries in the world except for Russia, India, and China. So just our transportation sector alone is pretty miserable. So I gave this presentation, now it's going on 14 years, to His Holiness the Dalai Lama in Dharamsala. And I presented these things, and he said, Jonathan, if you know pollution kills, your country is not showing not much compassion, right? And he's a smart guy, and I said, you're right. Let me think about this before I come back with an answer. And then I thought about, what would it take for us to really move on decarbonizing, getting off of fossil fuels? And I think if we take the health perspective, that combating climate change could be an incredible opportunity. Not only free, but beyond free, And I started publishing, this is my soapbox for the last 10 years, challenges and opportunities for global health. Solving the global climate crisis the greatest health opportunity of our times, low carbon future, improving global health and economic benefits, climate solutions double as health interventions. So why am I so positive about this, so optimistic? Well, look at the energy sector. You know, air pollution kills over 8 million people every year. So 8 million people die prematurely every year from air pollution. And of those 8 million, over 5 million premature deaths have been directly attributed to fossil fuels, to burning fossil fuels. And so this is something where you'd say, well, that's not good, right? You know, burning fossil fuels is killing a lot of people. I've grayed out the food sector because I don't have time to go into it much, but just to tell you that, you know, we have very energy-intensive diets, especially around red meat and corn. And if we were to adopt the universal healthy reference diet, which is pretty much the Mediterranean diet, very little or no meat, healthy vegetables, fish in the diet, that would save 11 million premature deaths every year. So know that, but I'm not going to go into that because of time. Transportation sector, physical inactivity and sedentary lifestyles. We all know that that's not good, leads to chronic diseases. And from biking and active commuting, walking, using transit and walking, you know, that affords enough exercise that it's estimated that right away we're saving 4 million lives from increasing physical activity. So let me dive into energy especially, and then a little bit of transportation before I wrap up. This is a map showing that in the United States, even though we have the fantastic Clean Air Act that was passed in the United States, we still have air pollution, and we still have somewhere between 75 to 100,000 people that die prematurely from air pollution, even in our country with the Clean Air Act. And you can see these regions, you know, where you still have, in the Ohio River Valley, you have coal-fired power plants, and this is where you see a lot of pollution. So one question is, what would it take to clean up the energy sector, you know, to stop burning fossil fuels? You know, what would the technology take, you know? So this is a study from more than 10 years ago by Jason West, leveraging off a study of our own Professor Greg Nemeth and Tracy Holloway, so really it comes from them, showing that, yeah, it might cost $30 to avoid pumping a ton of CO2 into the atmosphere. So that technology might be some upfront costs. But what happens when you burn coal that emits CO2 that heats the planet? What else do you get? You get all the nasty pollutants like sulfur dioxide, fine particulates, all those nasty pollutants. So that for every ton of CO2 that you avoid emitting, you also reduce the other nasty pollutants, sort of the conventional criteria pollutants that we know harm people. And so the health benefit would be $200 in health benefit for every ton of CO2 avoided. So I was in the state legislature a while back, and I asked them, I said, I want you to sit down because I'm going to ask you a really difficult question. I want you to think about this. Which number is bigger, 30 or 200? And I was pleased that some of them came up to me and said, you know what? We've only been thinking about the $30. We don't want to pay $30. We haven't been thinking about this other side, like, oh my God, what a huge benefit. So I was pleased that they said we hadn't thought about this. Well, obviously this is the bigger side of the equation, and we really need to be thinking about our energy choices and how public health comes into play and where that balances the equation. And of course, in developing countries, this benefit's even higher. But this $30 is probably wrong. So I'm going to show a slide from Professor Greg Nemeth, who wrote the book, How Solar Got So Cheap. And he presented in the state legislature last week, had something called the Energy University. And he presented this. The cost of photovoltaics has dropped 10,000-fold in the last 67 years. And according to a report, 2019, the cheapest way to generate electricity is now renewables and batteries. That wasn't true a few years ago, but now it's true. So anyone that says, yeah, we can't afford renewables, old story, old argument, very old argument. And so there's absolutely no excuse not to switch over to renewables for electricity. And he argues that solar is going to become the central source of energy. My group, the Climate Solutions for Health Laboratory, we do studies asking the question, what if we could get away from fossil fuels? What would the health benefit be? So my former student, Dr. Nick Mayu, did this analysis and said, okay, across the country, if we get rid of all fossil fuels across transportation, energy, and other sectors, what would happen? Well, we would save 50,000 lives every year. This is a headline from the Washington Post. And where would you see the most benefit? You remember the map of the Ohio River Valley and the coal-fired power plants. So the darker the blue, the more the benefits from decarbonizing and getting off of fossil fuels. Here's some traffic out in California here. So that's where you see the health benefits. Can Wisconsin get to clean energy? This is a former student of Tracy Holloway's. David Abel and Katja Speer did this study a few years back, and they said, yes, Wisconsin could easily get to in-state clean energy, mostly from utility scale solar and also onshore wind, but also energy efficiency, a little bit of nuclear and other things. So it's possible for Wisconsin, instead of paying out of state for our dirty energy, it's possible for us to move forward. I don't know if you know that there's a children's lawsuit now against the Public Service Commission and the state legislature for ruling on different energy projects without taking climate change into consideration. So stay tuned on this. There are 15 children now suing the state for not taking climate change into consideration and not shifting fast enough to renewables, although it was great to see that there's some new Badger Hollow wind project was just passed. Anyway, we can have clean energy in Wisconsin. A quick footnote, as we transition away from fossil fuels, we need to take care of communities that are dependent on that for their industry. So like support coal mining communities, but we can't burn any more coal. And it's crazy that the coal plant near Milwaukee is going to be pushed another 2 years, extended 2 years when it was about to shut down. That's immoral to me. But speaking of morality, we have got to take care of people that depend on these fossil fuels, but we can't burn them. I'm so glad to say that in a church here. So if we were to get to clean energy, that same study, this study here, the clean energy, what would that mean for health? In Wisconsin, you would save almost 2,000 lives every year. You'd have tens of thousands fewer asthma exacerbation cases, 650 fewer heart attacks. So clean air is healthy, right? And so energy policy is absolutely health policy, and we can have these great gains. If you added up the reduction of fine particulates, PM 2.5, and ozone, the bad ozone, not the good stratospheric ozone that protects from UV. Don't confuse that good ozone from the bad photochemical smog on the ground, that ozone. So PM 2.5 and ozone reduction would have enormous economic benefits. $21 billion a year in avoided mortality and health costs, and many more jobs in renewables. So it's a win for Wisconsin to get off of fossil fuels. There have been many comparisons, benefit cost estimates of, putting in clean energy systems and what's the resulting health benefit. And most of the studies either entirely offset or partially offset the upfront investment costs. So you can see, you know, they're partially offset here, but most of the studies show marked health benefits way outweigh the upfront investment costs of those energy systems. Quickly just shifting to transportation. So the US cities with the highest rates of walking and cycling have lower obesity and diabetes rates compared to the cities that have the least amount of walking and biking. And we all know that exercise is very healthy. Exercise does much more than just burning calories. Contracting muscles are chemical factories for agents that fight heart disease, cancer, dementia, and depression. So we all know that exercise is really healthy. I mean, it is really healthy. And so if we can design our environments so we can promote exercise as much as possible, that promotes health. We did a study for Trek bicycles and asked the question, you know, if people around the country had a biking amount that we have, you know, we have, I can't read that there, 6%, sorry. We have 6% bicycle commuting. The average national bicycle commuting is slightly less than 1%. But so 6%, I think this is for the metropolitan area. If 6% of Americans were bicycle commuting safely, that would save about 20,000 lives every year. If we got up to a level of Boulder, Colorado at 10%, that saves 30,000. If we were to bike at 40%, like in Amsterdam, that saves 60,000 lives every year. So, you know, it sort of begs the question, isn't it time that we design cities for people instead of for cars? Because we have done that. And we are so lucky in Madison. We are platinum ranked for bikeability. I came here on my wife's e-bike. I didn't want to be all sweaty when I arrived, so anyway. And speaking of e-bikes, are making a huge dent in oil demand. So I saw one of my colleagues' e-bikes, urban commuter. She's got 3-year-old twin daughters. I saw it parked outside. But these e-bikes are having a great effect, you know, impacting the demand for oil. So we are in an age of disinformation and crazy politics, but it's really important to know beyond what you see in the newspapers or on TV or on social media. God forbid you get too much social media, that we all get too much social media. This is where Americans really are. You know, this is 2014, and a few years ago now, look at the number of people that are either concerned or alarmed about climate change. It's a majority of people. And of course, you know, these dismissive 11% that hasn't changed much, you know, you'll hear them. You'll always hear them. They'll be very loud, and they won't be convincible. But notice where the population is. Most people are concerned about climate change. In fact, in Wisconsin, according to this Six Americas survey that's done every year, 7% of Wisconsinites, 70%, did I say 7? Yeah. 70% of Wisconsinites think that climate change is really concerning. They're either concerned or alarmed. So as far as things for you to do, knowing that where the population really stands, as opposed to headlines that are all over the place, where the population stands, the first thing that you should do is talk about climate change as much as possible. And remember that people are always running for office, And people running for office want to know what the population is worried about. So absolutely keep talking about it. Talk about climate change, and don't be shy about it. Here's some advice on how to talk about climate change. This is from a communications scientist, a colleague of mine, Ed Maybach. And, number one is it's real. Climate change is happening. It's not sunspots and other things. It's, the science shows, the humans are driving this. The human activity, burning fossil fuels and cutting down rainforests and losing the CO2 sinks, but primarily burning fossil fuels, we are causing this beyond known climate variability. So climate change is real, we're causing it. Experts agree. You've seen some of these examples. 99% of scientists that actually study climate change are fully on board and agree that climate change is a real threat and we're causing it. There are, a few outliers. There are a few climate scientists that disagree, but 99% versus 1%, that's a big deal. So it's real, it's us, experts agree. It's bad. You've seen how bad it is for health, but there's hope. And one of the most important messages is the hope message, that we're not waiting for a solution to happen miraculously. We have the solution right now. And with solar dropping, 10,000-fold in the last 67 years, there's no waiting for some eureka moment to save us. It's all a matter of political will right now. We have the solutions. We know how to solve this, but it's political will. So you need to really get out there and talk about it and know that as bad as the situation is, it's a golden opportunity. It is an absolute golden opportunity to shift away from fossil fuels. A second thing for you to do, I want you to be aware that as the federal government is rolling back climate regulations, that the states are stepping up to fill the gap. There are 4 states now that are following California's lead about a Climate Corporate Data Accountability Act. These are the states: New York, New Jersey, Illinois, Colorado, and Washington are close to passing. I think Illinois may have passed, if not very close to passing, a Climate Accountability Act, where corporations need to report their greenhouse gas emissions, their different levels of greenhouse gas emissions. So this is something that is really important. And Wisconsin is stepping forward. I just heard last week that they are pushing forward a climate accountability law. So Wisconsin now is on the books. And so a number 2 thing for you to do is to contact your state legislators and let them know what you think about a proposed climate accountability bill that would have corporations talk about how much greenhouse gases they're emitting. Now, in my role, I'm not allowed to tell you what to tell them, but I just wanted to, to tell them what you think about the climate accountability bill. But this is timing is really important. This is just starting, and it's really important that you talk to them, you learn about this, and step forward on this. So I'll just conclude by saying that today we have an opportunity of our lifetime to seize the moment, to decarbonize our economy, and at the same time vastly improve our health. So with that, I thank you very much.
All right, we've got some time for questions, and if you could raise your hand so I can bring the mic over to you so everyone can hear your question, that'd be great.
I've got a question. I just took a train from Chicago to Emeryville, which is the end of the line in California. for that trip. It was wonderful, but is there any talk of high-speed rail and, you know, that sort of thing that people might decide not to get on a plane? I mean, it was 2 nights and 3 days, and it was wonderful. I recommend it to anybody. But at the same time, what do we have to make up for the airplanes that
Right.
go and pollute?
Yeah, so trains are great. There's a big history of trains, and this is back in the 20s and 30s when the auto industry was trying to take over, and they actually bought up light rail and closed the tracks. They burned a trolley car in LA to say, that's the end of this antiquated transportation. Let's just sell cars and build highways. So there's a lot of history why we don't have trains versus Europe. But it is something to advocate for. Trains are very efficient. But we have that unfortunate history of going the, and in fact, the auto industry was sued for corporate takeover. I think they teamed up with Goodyear, and they were sued, given a slap on the wrist. But partly why we don't have a great train system is because of our industry battles back then. But trains are great, and we should keep pushing for them.
Are there any studies currently regarding the effects of hybrid and electric cars in terms of reduction levels nationally, even in the state?
Yeah, great question. So hybrid cars, it's a moving target. If you asked me that question 10 years ago, I would have said it depends where you live, because it all depends on where the electricity comes from for electric cars. And back then, hybrid was better than electric because we have so much coal for electricity. They're saying, well, electric's not that good. Now the landscape has shifted, and there are enough, we're getting off of coal more and more so that, hybrids make sense. But even most places in the country, which I would not say this 10 years ago, but now I'd say most places in the country, a fully electric vehicle is the way to go as far as total life cycle assessment. And Scott knows more about the life cycle assessment than I do, but it's shifting where electric vehicles actually are looking better and better.
I think there's the Union of Concerned Scientists. I know they used to put out a map every year, or fairly often, where you could see where in the parts of the country it was better to do electric, and now it's basically everywhere in the country. So in terms of, compared to gasoline, it's better. And as Jonathan said, we're adding more and more renewable energy, and so the grid is getting cleaner and cleaner, and so those benefits will keep getting better and better.
I can project a little bit if you're willing to. I have a son-in-law who is an electric battery engineer for Volvo, and he says PHEVs are the way to go right now, not EVs in terms of the
PHEVs, could you define that?
Plug-in hybrids?
PHEVs, the plug-in hybrids.
Right.
Where you get the full benefit of electrical use for the first 40 miles and so forth.
Yeah, we actually have a plug-in hybrid van that we use. So so for most trips are less than 40 miles, and so if you can be in all-electric mode for that, and then you have the gas engine for the longer trips, then the vast majority of your trips can be fully electric, and you get those benefits.
But boy, wouldn't it be nice to not have to fill up a tank with gas and deal with gas and oil?
We're in a period of climate amnesia, and perhaps you could talk about a way out of that. There's the hope and the idea that we should have good news to say, but actually there's been a tremendous setback in terms of urgency, perceived emergency. And how can that be recovered for people who essentially have never stopped feeling the urgency of it, trying to bring it back to public attention, but without being tediously preachy or whatever? How would you recover our sense, or do things have to get just awful, terrible?
So that's an elephant in the room question. So the current administration is absolutely going gangbusters trying to undo everything. They are totally advocating on behalf of oil and gas. The Interior, the Secretary is natural gas CEO. And so they are rolling back a lot of things. You know, the Inflation Reduction Act, which was the largest climate investment ever in the world, they're undoing a lot of that. So there's a lot of damage happening. So I grant you that things really are intentionally being reversed to go, you know, full out, stay on fossil fuels, to it's a missed opportunity as China races ahead and the rest of the world races ahead with renewables. We're going to be hurting in a few years regarding energy. But this is where there is, I'd say two things. One is to be more vocal. And what I mean by that is, for example, by the EPA trying to overturn the endangerment finding, they've put this issue of health and climate on the national stage. And so, you know, so those of us working on this are stepping forward and, you know, making it known that no, the science is getting better, not worse. Secondly is to pivot to local. The national politics may be a lost cause for a while, but Wisconsin, and with this climate accountability bill, there are a lot of states that are moving forward. The children's lawsuit is something as well. You know, these are things that pivot to local. Don't be quiet. You know, keep, you know, standing up and being known and talking to your representatives. That still matters, but it may matter more in Wisconsin than in Washington. And this is where I think we can continue to have progress, because as we all know, you know, politics is local, right? And so I think we now turn locally would be my recommendation. But be loud, you know, amp up the volume and go locally.
This is with reference to your wonderful slide with that huge mosquito. Todd and I were talking recently about the fact that we've noticed that our plants, it's October, they don't seem as chewed up as they normally are at this time of the year, which led me to hypothesize, well, does that mean that we have fewer insects? I know there's been a lot of commentary about losing pollinators and fewer songbirds and all of those sorts of things. Do you think that's all heat related? As at least an important factor. I know there's not just one.
Yeah. So interesting. I don't know the answer to that. I can just tell you that aspects of land use change, climate are shifting all sorts of mammals and insects. So it's hard for me to say climate or agricultural practices or land use change. It's beyond my expertise. But I do know there are some insect vectors that carry disease, like Aedes aegypti mosquito that carries dengue fever and Zika virus. Warmer temperatures allow that mosquito to move north. I'm sure you've heard of the Lone Star tick, that, you know, if you get bitten by the tick, you get this meat allergy, right? And that has moved north. So things are moving north that I'd be concerned about regarding infectious diseases. Lyme disease is very complicated itself. You know, temperatures have a lot to do with the larval stage and things like that. But the land use change and Lyme disease is totally complicated. I defer to Chris. Where's Chris?
I think Chris had to
Okay. I defer to someone from our National Center for. Okay, so hard to answer that. Sorry.
Yeah, and then Peter Levy can say more on species effects of climate.
Is he at the National Center for Wildlife Health?
He's with the Nature Conservancy.
Oh, Nature.
Yeah,
right,
he's
okay.
the science director for the Wisconsin chapter of the Nature Conservancy.
Okay, great. So hold your question until next week.
2 weeks.
2 weeks.
Your talk has been very informal today. What I'm wondering is, I'm not as good as you at explaining all of this. Are you getting opportunities to speak throughout Wisconsin to help educate the population about climate and how it's affecting our health?
Yes, well, me and an army of people. I'm part of a group called Healthy Climate Wisconsin. So I'm at the university, but also this group of clinicians, doctors, nurses, physical therapists, many health professions, they're getting out there, and clinicians are very trusted messengers. Although I know that Barbara, we had, you know, so the vaccine hesitancy issue but still, clinicians are relatively, you know, credible and respected communicators. So Healthy Climate Wisconsin, I spoke at the Energy University at the state legislature. I spoke at last week's Climate March with Greg Nemeth. So I'm getting out there. But I think that there are other groups as well. We're collaborating with other groups, and the key thing is to network. You know, the most important thing, Bill McKibben, you know, the famous environmental writer, Bill McKibben said, when asked, what's the most important thing an individual can do? His answer was, don't be an individual. You know, link up with groups, make your voice heard, get engaged, and that's, you know, so that's happening, and we're trying to be a network of networks and getting the message out.
When you were talking about wildfires, and you mentioned that, you know, good forestation practices are part of why some of these wildfires are happening, how is climate change playing into that? Is it more storms that are causing the problem, or because we've seen such an increase of days where the air quality is so bad and you can see the smoke, and what all is contributing?
Right. Yeah, so the climate change effect is on the extremes of precipitation or the lack of precipitation. And I put up the paper from the Proceedings of the National Academy that showed that climate change is making the fuel wood that causes the fires much more arid, like significantly more arid. And so it's fuel for these fires. So it's mostly that increased risk of aridity as a trigger for a wildfire. And, you know, the land practices vary all over the place, but, you know, this is something that is rock solid of, okay, well, here's what the impact of long-term climate aridity is doing, the droughts and the extremes of the droughts is doing. That's the main contribution of climate change.
Well, I'll ask a question, if I may.
Sure.
A decade or so ago, I don't know how many of us would have anticipated what we now anticipate to be a great increase in demand for electricity, largely driven by artificial intelligence-related data centers, which is often quoted as one of the reasons for making coal great again. Would you have any comments for us on that situation and how that plays into the grid and renewable energy?
Yeah, I'm so glad you asked that question because, you know, we're having accelerating increase in demand for electricity. Well, the question is, how do you want to power those? Do you want it powered by dirty coal that kills people downwind? Or do you want to power it by now cheaper renewables that has no health impact? So I think it's something, especially for a church audience, that you know, morality is very high and you want to do the right thing. You know, we don't want to choose the source of electricity that we know is going to harm people. And so I would absolutely be vocal on this to say, yeah, we need electricity. We need more electricity, but we don't need it coming from that dirty coal-fired power plant, especially when renewables are so cheap now. So bring on the electricity demand, but have it powered so you don't harm people downwind. I think it's a really important topic, especially in Wisconsin, especially now. Demand that these data centers are powered in a health-friendly way.
I agree with everything you're saying. I'm going to be a little devil's advocate here. Now, if I go and talk to my redneck relatives up north, friends, they'll say, well, is the farmer supposed to go in his huge field of soybeans and wheat and whatever, and how is he going to have electricity on his harvesting machines and his planting machines, etc.? It can't quite be all or nothing, is what they would say.
Yeah, yeah. I mean, I don't pretend to be an expert farmer, but I would just say we need to go for the low-hanging fruit where it's really easy to convert over, like large electric power stations or disseminated solar. Like, let's do that. Let's do the easy things first, and then farm tractors, airplanes, whatever is going to take a little bit longer, you know, as far as converting over from fossil fuels to electric. We can take our time and do that eventually, but go for the low-hanging fruit, big system change first, and don't. I wouldn't want to say to a farmer, "Hey, you can't do your gasoline John Deere tractor anymore." But I'm sure there are going to be options pretty darn soon, probably already, right? So, but this is where go for the easy things first. But don't mandate that we have to do whole change of everything all at once.
Yes, Jonathan, thanks for the great talk. One thing I'm curious about is we've gone to shopping online and delivery trucks all over our neighborhoods. And I wonder if anybody's looked at the effect of that, if that, it's actually beneficial because fewer of us are going to Walmart or whatever, or is that harmful, all those delivery trucks?
Karen, great question. And what it involves is we need to have a systems approach to these things. You don't drive to the mall, but a truck delivers something. And so many people are using Amazon, that's a lot of truck deliveries, right? Well, Amazon they have electric trucks, or they're starting to convert over. So if they can convert more trucks to electric, maybe in the end it would be a better thing. On the other hand, if it enables people to order everything every day and there are just trucks all over the place delivering to people's homes, that's not a good thing either. So we need to basically take a systems approach to it and figure that out.
Yeah, I think part of it too is how full are those trucks, and so the fuller the truck, then the more efficient it is. Whereas if you're just driving your car and you're getting a couple items and driving back, then that's a little less efficient. So yeah, it's really take that whole view of the whole system to figure out is this more efficient.
At one time, the church looked at putting solar on the roof, and that was controversial, and people were worried about tiles and whatever. I have seen pictures where parking lots have solar, like a canopy, and cars are underneath, is that system, and the same thing in our condo, we talked about putting solar on the roof. Is that system very expensive where you have the parking lot and then you have this canopy of solar panels? Are you familiar with that at all?
Sure. I know, Epic, the big health data center, data company, they do that. They have solar panels over their parking lot out in Fitchburg at the Epic facility. I think it's a great idea. I mean, any place that you can find to put solar, now it's cheap. When I put my solar up, it was expensive, but now it's cheap. So I don't know of any reason not to put solar up. There are also groups doing what's called agrovoltaics, putting solar up, and under the solar panels, they're growing shade-grown plants. And they're also trying to grow plants that are good for pollinator, bee species, and things like that. So there are solutions, a ton of solutions out there. But the more we can get solar, I'll just go from Greg Nemet's last book, there's no reason to hold back. Solar is cheap, and we should just, I think, go full out with it.
What would it take to get the city of Madison to require solar on top of all these buildings that are being built all over town? Because you could certainly heat hot water centrally through that.
Yeah, you guys should go talk to them.
You actually need to talk to the state legislature because the state legislature forbids cities from setting any building codes that are stricter than the state level.
Okay, so talk to them.
So talk to state legislature
Yeah.
first.
Yeah.
Actually, I have a question. Going back to the, clinicians are trusted sources of information. I've been thinking about, some of these actions and could this be a conversation in your annual checkup where, your doctor says, oh, do you need to get more exercise? Let's find, what are your commutes right now? Let's see where you could ride a bike for those commutes. Or, how is your home heated right now? Could we get you a heat pump, to be more efficient and have a healthier air quality environment? What do you think? Is that an appropriate source for disseminating that information?
Yeah. Great question. So I have two things to say about that. One is, yes, you should lead by example. If you can take transit or active travel, instead of a car, great. And Madison's a great place to do that. If you can eat lower on the food chain and have less meat in the diet, that's really important. If you can power your house, ask the utilities, say you want to make sure you're on the renewable, you're bringing renewable energy for your house. On the one hand, yes, you should do that and lead by example. On the other hand, what you do as an individual is not enough. And big corporations, especially fossil fuel, they want you to say, it's my problem, I'm going to do the right thing. So you need to do the right thing, yes, and show, lead by example. But also you need to demand broader system change and go up the level to say, hey, why is this a default? And demand from your legislators, to do things more sustainably. And we've been great. We've designed this city. We're platinum ranked for bikeability. What are some other areas that we can have gains? Can we demand solar on everything? So be the responsible individual, but know that being the individual, doing the right things as an individual, it's a system-wide problem, and you need to step up and join groups and demand bigger actions.
Well, I think we're a little past our 1 hour, even given the late start that we had. I want to remind you, since one of Jonathan's emphases was on talking about climate, environment, and human health, come to our mini workshop next week on finding your climate story. And then let's thank Jonathan for a fantastic presentation.